incredible how negligent and stupid doctors can be. And I knew this from firsthand experience. And I now recently had this, I've seen it from secondhand through other people, but now directly through somebody I really care about, my wife, which I got married recently. Yay. But she had a sudden neurological attack where she was unable, she got progressively fatigued across the day. She then lost control of her entire body. And so when EMS showed up, when I called 911, she was just completely limp on the bed, unable to move. Her eyes were crossed. And when she got to the hospital, she had very extreme weakness in upper extremities and complete paralysis in her lower extremities. She had left arm droop. She had partial facial palsy, upward gaze nystagmus. Some of these things I find easily on just a workup while the nurses were out of the room. Some of them the doctors found themselves. That all I have to say is some things are missed. They did an okay workup that for initial emergency room visit. They did an actual MRI of the head and spine, but they didn't use contrast, which I think is bizarre, because if you're looking for a neuroinflammatory disease, not to mention in general, you don't want to do an MRI with and without contrast, but that would just take longer, so they did without contrast, which is essentially useless unless you're looking for old lesions, right? Old scarring. But we're looking at an active problem, and if it's an inflammatory issue, you'd want to look for contrast hyperintensities. Pretty basic stuff. She basically got fluids. She retained most of her ability, or regained most of her abilities, and was sent home. She's then had multiple attacks since then, some of them equally severe, some of them less severe. She's basically bedridden right now. Last night, I know I had to change her, take care of her, carry her to and from the bath. She has a daughter. I now have a stepdaughter. She can't be with because of this, and I know a lot about how to navigate the medical system, and I've tried my best, and I am streamlining the process to getting her care. But even with all the knowledge that I have from the experience that I had going through encephalitis, how to navigate primary care versus specialties, how to find a good specialist, how to get care as fast as possible, how to be the squeaky wheel and ride that fine line between respecting a doctor's profession while also pushing for the things that are best without bruising their ego, which, in one case I overstepped, right? So we went to the ER a second time, and the PA there, I'm like, can you do an, I was immediately saying, I just crossed the line, and I was saying, I'm thinking we could do an MRI without contrast. Here's some other diagnostics we could possibly do while we're in there. We could do an MRA, an angiogram to check for any vascular issues, and an LP to rule out any with a send-out panel for autoimmune, for autoantibodies. And that would also give us basic stuff like glucose and protein to see if there's any inflammatory markers going on in her CSF. These are all very basic things you expect a doctor to do when they have a patient that comes in presenting with full paralysis of lower extremities and weakness in upper extremities. The possible differential diagnosis or working diagnosis upon initial discharge from the first emergency room visit was a transient ischemic attack on the spinal cord, which was very likely at the time. But since she had a second episode, it was very unlikely. And so now there's high likelihood of a neurological disorder or disease going on. However, the neurology team on the second emergency room visit deemed that, probably based on the PA's notes, because his ego was bruised that I brought up those things, and they neglected us for hours. They put a port in her arm, but no IV fluids. So, and then we were left for hours. I went to pester the guy to get him to come in. He said he'd be there in 4 minutes. It was another hour. She had a port in her arm with no IV fluids going in, but she wasn't allowed to drink or eat. So she was just starving and thirsting to death. And by the time we were done, nothing was done but a chest x-ray. For what? An embolism? An embolus? It's clinically irrelevant. And that's all we had done. And so she just left dehydrated and starving to death. And I was rolling her out on a wheelchair because she couldn't fucking walk. And she was bawling her eyes out, and all the nurses were looking at her like, why is she being rolled out of the ER in this state? It was terrible and extremely traumatic to her, and I know exactly what it's like because I've heard the same phrases and I've experienced the same thing. It's terrible. But the neurology team there, which is no doubt just one guy behind a computer remotely, he said he spoke to the neurology team. The neurology team deemed that there was no need for further diagnostic testing. And so at that point, I knew we were losing a battle, and so I did my best to squeeze some steroids out of him, corticosteroids, and an urgent referral to neurology, which is funny because he agreed to the urgent referral to neurology, but the neurology team said there was no need for further neurological diagnostics. So where's the logic there? And by that point, again, she was still completely unable to move her legs, unable to walk, nothing. You know, they were asking if she was pregnant. She said no. They did an ACG test on her anyway, which is kind of shitty for on them. It's not illegal, but it's just shitty. Anyway, there's just there is a massive need, I think, for patient advocacy in the medical field from people who have been through the shit. And while right now I need to make money the good old-fashioned way, I have a desire to do that. You know, I've had a desire to be a PA, so I can be the person that, health professional that wasn't there for me. But then I've also had a desire to be a patient advocate, and then none of this has happened firsthand. I'm just like, I'm fucking sick of this shit. These people are terrible. These doctors are shitty. They're mean. They're outright mean. They disregard you. They're blatantly stupid, right? So somebody comes in, let's say you do a case for a resident, right? A neuro resident. And the chief resident goes, okay, so we have a case of a woman, 30-year-old, otherwise healthy, all CMP, CBC. Parameters are normal. She comes in with full paralysis of the lower extremities, partial paralysis of the upper extremities, and involuntary control of her eyes. What would you do? And the resident wouldn't say, non-contrast MRI and fluids. He would be laughed at and fucking kicked out of fucking school. I mean, he'd be laughed out of the fucking classroom. No, they would probably say, well, we want to do an LP to check for any of the basic inflammatory markers and other issues, metabolic issues. Probably do an autoantibody panel, send out to make sure there's no autoimmune condition going on. Then we'd want to do an MRI with and without contrast. They'd probably start with a CT, which is normal, and then do an MRI with and without contrast to see if there's any hyperintensities there, because we want to rule out things like MS, Hashimoto's, post-infectious encephalitis, all these things. That would be the right answer, right? And then you could do more niche serum labs, but they don't actually do that at the ER. They don't actually do that at the ER. So the things that they pretend like they're going to do in residency, they actually don't do in the real world. All they want to do is just get you good enough to roll out of the fucking ER. They don't care about a prognosis. They don't care about a working diagnosis. They don't care about aftercare. They don't give a shit about anything. In fact, the ER, yes, should almost always be the first stop when you're having an emergent problem like this. But in most cases, it shouldn't be your second or your third. You know, I almost regret bringing her in the second time. I do regret, because there was nothing came from it, and I don't know why I expected anything more, because the ED was completely useless to me when I was sick. They do nothing but gaslight you and shoot you out the room. I had notes from my neurologist saying that I responded well to corticosteroids, and when I was having a flare-up of my autoimmune encephalitis, I went into the emergency room with the notes in my hand saying that I respond well to high-dose corticosteroids. And the internist there said, sometimes the further you look, the further you get away from the truth, which is an asinine fucking thing to say about any aspect of life, right? The more you look, the closer you get to the truth. And then she said, I don't think that corticosteroids are, deemed necessary or appropriate for this condition, or based on your notes. They called someone on call at my neurology clinic, and they agreed that it wasn't necessary. And then when I spoke to my neurologist next time, she was like, okay, let me talk to that person that was on call, because that was not right, essentially, was what she was saying. I constantly ask myself the question where doctors lost their passion for medicine along the way. Was it in med school? Did they get burnout? Are they tired of hearing the crazy patients? But then when I think that, I think read the room, right? Is this person a crazy patient? Are they saying ridiculous things? Are they, should it be taught in medical school to not assume that the person is just faking it? right? Because there's a lot of that implication going on around the hospital by nurses and PAs with my wife when she couldn't fucking walk. And it's like, I only have so much control, so I'm trying to push in certain areas without bruising anybody's egos. It's a fucking mess. United States healthcare is a fucking disaster. And it's about time people, I don't know what to do, man. I just don't know what to do. I'm just on a fucking rant right now because this devil was out of my life, right? You know, I still have issues from autoimmune encephalitis left over, but it's out of my life, on its way out. And then it comes back in a different form. All of a sudden, with my wife and the shit I hear in the ER, the experience that she's having just reflects so strongly on the experience that I had. It's just on a faster, accelerated path. She's much farther ahead, and not in an egotistical way, but just because I have the knowledge from my experience on how to navigate the medical system. I know how to get the care that she needs as fast as possible, or literally going as fast as humanly possible. And even then, it could take months. But months is better than years, so there's that. But I don't know, man. Emergency care physicians are shit. I guess we'll just end it there. But there's definitely a huge gap in patient advocacy that needs to be filled by individuals who've actually been through the ringer and who have learned from it and know how to use it for the advantage of other people. All right, that's my rant for today. I might set up my PC so I actually do videos again. It's been so long. Because it's kind of a good way to vent for me. Some people find it useful there here now and again. Some people hit me up on Reddit for some help, and I'm happy to help them. So if you need guidance at all, I'm happy to help. You can hit me up on Reddit as u/the_bro scientist, and we can have a conversation. I have conversations with guys and gals every once in a while. Less frequent now as my life has kind of become more busy and even focused on her, but I don't want people ever to feel like they're left hung and high and dry and with nobody on their team. There's nothing that feels worse than that. All right, that's it. I'm sure this video will get like 50 views. Don't really give a shit. Just gonna rant. I'll talk to you guys later. Hope you're doing all right. Peace.